Okay, sorry, you're stuck with me for a third time on Wednesday night because now I'm answering to Christine D. I think there's too many followers named Christine, so, alright, you're the last Christine. Everyone else has to change their name. No, just kidding. Christine actually brings up a good point. Would I make appointments and charge for online consults? We need to find out when it would work for both of us, both parties. We need to work out a payment system, and we would need to work out all these details. If somebody wants to put together a proposal to send to me, I'd be more than happy to consider that, and with the permission of the patient, I would always consider keeping everything about them private and disclosing the results, if you will. Anyway, I may have touched on this before. I don't know. I have very busy days. But Christine, in this case, has a positive SSB antibody. Her antibody fluctuates. And she had another antibody positive, and for argument's sake, it was either the ANA or the RNP. I don't recall which one. And her question had to do with why do the titers sometimes show up and why do they sometimes not show up. And so first of all, it's been long said that to have a diagnosis of lupus, and this, I grant you, it's by the so-called old criteria, which frankly I like the old criteria better than the new criteria. And for those hotshots who've done rheumatology training in the last 5 or 10 years who think they know more than me, that's their prerogative to think that way, but there are also people that like Bernie Sanders. So anyway, or even worse, Ocasio-Cortez. So what my point is, it can take 25 years to make a diagnosis of lupus. What do I mean? How can it take 25 years? Well, if you have to have a certain amount of things occur, and by the way, keep in mind, the diagnosis of lupus, according to the literature, is always based on research criteria. So it's so somebody can enroll you in a trial and have money given to them by usually a pharmaceutical company experimenting on a drug. So you don't need to meet any of the criteria, and you don't need to fulfill anything other than a logical, intelligent rheumatologist who takes a great history and does a good physical, comes to a great conclusion that you have lupus. And since we have hardly any drugs that are approved for lupus, we have a wide variety of what we do and can use. And frankly, I find that if people are compliant and take their medications, they do very well. The worst prognostic group, black females under 24 years old, do very poorly for a variety of reasons. And white men that are elderly tend to have a better prognosis, and they do better. And I'm going to tell you right now, I've seen a lot of teenage black girls that do very, very well. And I've seen a handful of elderly white men do very, very poorly. So the rules apply for board exams and for the masses, but every person has to be taken on his own merit or her own merit. So regarding the antibodies, you can have an ANA in a very high titer. A titer and a number of dilutions essentially are the same. So what do I mean? You take a bit of blood called an aliquot. You put it on, we'll say you put it in a saucer, and you want to dilute out the ANA. Well, you put in something that, for argument's sake, dissolves the ANA. Well, if you put in that product, which we'll call a substrate, you put in that substrate 11 times, and you still cannot get rid of the ANA, you have a very strongly positive ANA. And the number on 11 dilutions would be, and the numbering system starts at 40. So 1 dilution is 40, 2 is 80, 3 is 160. So those 3 are generally considered to be normal, or maybe they're associated with a non-rheumatologic autoimmune disease. They can easily be associated with pernicious anemia or Hashimoto's thyroid disease or any one of your favorite diseases, whether it's biliary cirrhosis, whether it's autoimmune hepatitis, whether it's MAG arthropathy, So many things cause positive ANA. And then some people simply have positive A for no reason, but I don't want to get thrown off topic. So the ANA comes back 40, 80, 160, 320, 640, 1280. That's 6 dilutions. Anything more than 6 dilutions is a very high test, and that's considered to be a definite positive. The titer is the same as saying how high it is, and the type would be the pattern, homogeneous, speckled, nucleolar. These are different patterns that, while they're not specific, there's the centromere, which is often specific for limited scleroderma. Not diffuse sclerosis, but limited. And homogeneous, or the other ones, are often seen in lupus. The speckled and the nucleolar can be seen in progressive systemic sclerosis, Sjogren's, or you could see any of these even in rheumatoid arthritis. There's really no rules for ANA other than the fact that it is a very sensitive test, meaning it's all over the place, but it's not very specific for a particular diagnosis. So if you have a normal person that has a high ANA, there's a good chance they have nothing wrong with them. So you have to be careful and you have to be tuned in as to why did my doctor order the ANA? If the answer is it's part of the routine screen, well, then the test shouldn't even be discussed and it should be canceled. But if it's because you have joint pain, pleurisy, in men testicular pain, or if somebody has hair loss with bald spots and patches of skin that look discolored, or rashes, or trouble with the sun, allergies to sulfa, fingers turning white, blue, and red when they're cold for anywhere from 5 to 60 minutes, that and a whole host of symptoms would lead somebody to think of autoimmunity. Other symptoms would be true muscle weakness, with or without pain. So, again, why is it high sometimes and low other times? Well, generally, and I'm not avoiding the answer, but generally we try to follow lupus activity. We're not good at doing that. We try to follow inflammation. We're not good at doing that. And the testing that we can do is often to check whether or not there's going to be an impending crisis with the kidneys. And this is when we look for decreasing or dropping complement levels. Your doctor should be checking your C3, your C4, and your CH50, keeping in mind that C4 deficiency is the most common deficiency, and this is associated with a lupus diagnosis frequently. Also, an elevated or rising double-stranded DNA is not a good prognostic indicator. It means that the disease or the disease activity it's a volcano getting ready to erupt. Now, it's technically impossible to have a positive DNA without a positive ANA. So if you have a DNA show up in the lab as positive and a negative ANA, that's like telling me you found the yolk, but there was never an egg. So this is not a possible scenario. So it could be that the lab did the test wrong. It could be the blood sat out too long. It could be a lot of factors. But in being a purist, it can't occur in real life. You really have to have that investigated. It's not a common scenario, but to be aware it can happen. But why is it that some days our antibodies are high and some days they're low and some days they disappear? I don't think anybody has a really good explanation, but it's important to understand that you just need your ANA to be high on one occasion with features that can't be explained by viruses or cancers. And you say, gee, in 1995 my ANA was 25,000, and in 5 years later I had pleurisy 3 times and nobody could understand why. And 4 years later I had a rash and they said I had skin lupus. Well, with those 3 facts, you have lupus. And your ANA, it was never positive again, but at that point in time it was, and it was high enough so it was definite. It was not equivocal, or which means might be. I probably rambled a lot tonight, but I hope I gave some good information. It's past my bedtime. And kudos to me, I got in an 18 or 19 mile bike ride tonight. Everybody out there in bicycle land or not, they should be riding their bike and trying to keep themselves fit. Remember, your body is a machine. You need to feed it well, you need to hydrate it well, and you need to use it. So you can eat a lot, but you got to exercise a lot. And you got to watch what you take in, because they say you are what you eat, and I do believe that's true. Good night.